Our bodies and their movements are greatly aided by the joints and bones. However, some conditions can hurt the joints and bones. Bone is a living tissue. It constantly revamps itself by growing new cells and breaking down the old ones. If the growth exceeds the breakdown, then the bones will improve. Like during our childhood, when our bones grow stronger, and our adolescence, where our bones grow longer and we become taller. The bone density peaks between 20 to 40 years of age. But when the balance shifts and the breakdown outdoes the growth, our bones become compromised and lose their density. Osteoporosis is a condition when our bones become less dense and become very fragile. It shows no symptoms and develops slowly in the background over the year. That is, until a common fall or simple impact suddenly breaks your bones. Unlike Paget's disease, which usually only affects a single bone or is localized in an area, osteoporosis is spread to all bones of our body. The following advice can help you reduce the risk of osteoporosis. Add plenty of calcium and vitamin D as part of a well-balanced diet. They can be obtained from dairy products such as milk, cheese and yogurt, along with milk made from soy, rice or oats. Do exercise regularly, especially resistance training using dumbbells or posture training such as Tai Chi. Quit smoking and drinking if you are still doing them now. To treat your osteoporosis, you can consult with a rheumatologist. To diagnose, they would advise you on a particular test called DEXA scan for diagnosis. This test measures bone density. The possible results are normal, so the risk of a low-impact fracture is low. Osteopenia, which means that you have a small risk of a low-impact fracture, but your bone is already weaker than the average one. Osteoporosis, which is when you have a greater risk of low-impact fractures. Discuss this with your doctor as you may need treatment. This test is done before starting treatment and can later be repeated at 2 to 5 year intervals as per your doctor's advice. Bisphosphonates, such as zoledronic acid treatment, will prevent bone resorption by binding to the bone mineral and induce apoptosis of osteoclast. Teriparatide, which is a synthetic, simpler human parathyroid hormone. It will promote the growth of the bone by decreasing bone turnover. Raloxifene, which has the benefit of estrogen hormone without its drawback, can treat postmenopausal osteoporosis. Denosumab, a monoclonal antibody, prevents the maturation of osteoclast. Treatments such as strontium ranelate are under scrutiny due to their dangerous side effects. All of them will help to increase the BMD or bone mineral density. Remember, bone renewal is a slow process. Even though you won't be able to feel whether or not it's working, your bone density should start to improve after 6 to 12 months. Your doctor may suggest a break from your treatment after 3 to 5 years, but the effect of the treatment will still continue later. Osteoarthritis is the most common disease that damages a joint and causes stiffness and pain. The knee is one of the most affected joints, along with the hands, hips and spine. Condition. A normal joint is formed by 2 bones. The end of each bone is covered with a cartilage which has a smooth, slippery surface that allows the ends of the bones to move against each other almost without friction. When a joint develops osteoarthritis, some of the cartilage covering the ends of the bones gradually roughens and becomes thin, and the knee develops swelling and pain. Symptoms. Pain, stiffness and restricted movement. Crepitus, or the sensation of grinding or creaking when the affected joint moves. Bony swelling. Excess fluid, joint instability, weakness and thinning of the thigh muscle. Risk factor. Obesity, high body mass, means a higher load for the joint. Previous joint injury or disease, even when already healed. Increasing age, genetic factor and gender, as women have a higher chance to develop the disease than men. Self-help. There's no cure for osteoarthritis yet, but there's a lot you can do to improve your symptoms. Lose weight if you're overweight. Exercise regularly, both muscle strengthening and general aerobic exercise. Reduce stress on the affected joint. Break the harder jobs up into chunks and do something more gentle in between. Wear appropriate footwear, for example, low-heeled shoes with soft, thick soles. Use a walking stick or walker. Use the handrail for support when going up or down stairs. Modify your home, car or workplace to reduce unnecessary strain. Don't keep your knee still in a bent position for too long. Apply heat or ice packs. Use painkillers or anti-inflammatory creams, gels and tablets. Remember to read the label first. There are some medications that don't have a proven role yet but are still used, such as glucosamine and chondroitin, and also acupuncture. Treatments. If you still have pain after trying self-help measures, seek help from a rheumatologist. The rheumatologist would examine you and advise you to go for an imaging test like X-ray or MRI, or take your joint fluid for analysis. If required, a rheumatologist may recommend the following treatments: stronger painkillers, steroid injections into the painful joint, capsaicin cream. Always follow your rheumatologist's advice for the proper dose and duration of the medicine. A surgery, including joint replacement, may be needed for intolerable pain.
Thank you for your continuous support, especially our valued patrons and members who have been encouraging us to keep producing more quality content.